I'm on the road late. I hope my phone doesn't go off. So but I'll go ahead and say a short prayer. Yeah, chair. Can you guys hear me? Oh,
Loud and clear.
Agustina. All right. Agustin Kotosin last so to that deal. Ni Thailand sun lo ni koron ya na de di sin aro I watch all kids ko ba he Quinton I at ya na dan his kado kon kinada ko ba he Quinton di hasin so ya أخذني خاطرني دي Health Education Human Service Committee كده نوعي كده وده إنهنا نشده نيلزن كوباكي كوينسن دي ده كده أدو تا كون كده Health Committee كده نو أجن نكين دي نيشتو أخانس دي كيس أصلا كده إياه كده دنه fight إيشن بقى يهود إنهنا نشده President Nez or Vice President Lai. I think so. Kuroda is go Sato Banana Shiosen. I don't the debate sponsor under so Anna Dinting or so. Kuroto that ka nature Nizaka Kaishin Nabayat Etole to get it to the Benyat on. It don't can low Hashin so the Nebuchadnezzar deal. Aron nadi de ni mado ni je ni masando ni cheda egi khore so ego atin de ani son hachenda atini chenda hu nadi de na ni ge ide kosen sana se za tapde no it ati ego in hinarnes ko it so tada akhada hulian go do ta ta hulian o ta de bnache tikra se khojni ma se khoji gi Yego, the Gunana Kilano Bahan, the Bedahodit, Egg, a cold quag, that's a balcony zone. They are a little could you not just short, see that Thanksgiving agent, also huge another desk. Because I is about the Williams, they are a night or how quite over had the cold quag. Beta the honey, no, they yet a good in the so that hot to the deals, no, so that's what the Naya been hit deal. So a bad honey, so she hasn't so yet a Nason hidden by it hit opposite only. I don't the corner and me hasn't so it enter with a when you get it that only a so a or hajo by it hit all to the Hatashi by it or let it out. A vice adil now a yat ina so nihna seni list on list aro mikit one no a mahazono a kut ko asin ni tata ala shibinash an ala shibin shagatna but ala shin to the hidi ke say 1,000 that I need them akut in the so that nan sa case it or isin to adon ne bayat eto legi akut out is listen no a then should I need oh they be like a but send that they go put out they been not on the issue at 8 or late belanda yitley a co quite or chomba he wins and any other that one make it one lloyd on I can low with a she doesn't say chile yard ashik is the sequence and the code a pen out on seat now to the rahota see that con see that that chill that that come back with his it on I can low it that on a be when he can eat a great back in his and Adodiat ever 8 lazy cut when you get it out on Tigishiat ever 18 on the study list those from Goyat ever Hashin down hit that he at away under the Katoyat on another hidika. One so it could also the Zanibe Hanana State or the so Yat Ocean hit at all us. do is aston is bench Shenitsen, upon so the Zuni, Behanana State or the Station out of Kitchen, Niget Asai Bijibanas, Jesus Christ, Amen. They had last excellent. I see. You know, there is in between the I thought, you know, to church or but she had other she's still the citizen, the didn't know the yard egg out a CK story. But as a committee members, do you have any announcements? Sure, this is Wanika. Oh, Cecilia, go ahead. Sure. Oh, go ahead. Thank you, Chair and members of the committee. I have some things that's very important that I need to take care of tomorrow. So at a regular meeting tomorrow at 10, if I'm not on, I'd like to be excused, but if I'm able to take care of what I need to, then I'll be on at 10. I just want to let you know. Thank you. Sheila, and just for your information, that legislation to confirm superintendent, it should be the 5-day comment period should be up to date. So it should be available for action tomorrow morning. I don't know how speaker is going to proceed about administrative leave for staff. The executive branch, so if that happens, perhaps tomorrow we just take care of legislation and that one legislation and then proceed to adjournment though they committee members, auto staff, those are my thoughts as we go into the afternoon and then thoughts for tomorrow. And of course, these two legislation that we're going to be looking at through today's work session. The expression of the limited waiver of sovereign immunity for the state of Arizona and the state of New Mexico. That brings us to item number 2, recognizing guests and officials. Staff and others that are on the call, please introduce yourself.
Good afternoon. This is Dana Bobrov, Office of Legislative Counsel. I'm covering this work session for Chad Abeda, who is on leave this afternoon.
Hello, Anyat. This is Michelle or Dr. Branzer with Division of Behavioral and Mental Health Services, the Health Services Administrator.
Hello, this is Arsenio Charleston, Benefits Coordinator for Division of Behavioral and Mental Health Services. Thank you.
Good afternoon. This is Tanya Shepard, Senior Programs and Project Specialist with Division of Behavioral and Mental Health Services.
Good morning, Chair and committee members. This is Michelle Morris, Legislative Analyst for Department of Health on the call.
Good afternoon. This is Zuri Deschini with the Navajo Nation Department of Justice. I am covering for Attorney Michelle Begay. Thank you.
Anybody else? Miss Angelita Benali, could you review the proposed work session agenda with us, please?
Yes, this is Angelita Benali. Good afternoon, Mr. Chair and members of the Health, Education, and Human Services Committee and all who have joined the work session. You have your proposed agenda for the Health, Education, and Human Services Committee, 24th Navajo Nation Council work session, November 23rd, 2021. And presiding is the Honorable Daniel Iso as chairperson and the Honorable Carl R. Slater as vice chairperson. Places via telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting or call work session to order. Roll call, invocation, announcements. 2, recognize guests and visiting officials. 3, review agenda. 4, work session reports. And A is the limited waiver of sovereign immunity for New Mexico Human Services Department, Medicaid in parentheses, and the Arizona Healthcare Cost Containment System, also in parentheses, is Medicaid. And it'll be given a general overview with reference to legislation number 0244-21. And also, I did send out a legislation 241-21, which was released the other evening, and that's for regarding New Mexico. Also on the agenda are the issues and concerns for the limited waiver of sovereign immunity. Presenters are Dr. Michelle Brancer, Delegated Health Service Administrator, Arsenio Charleston, Benefits Coordinator Tanya Shepard, Senior Program and Project Specialist Nicole Begay, Program Evaluation Specialist, all from the Division of Behavioral and Mental Health Services. Also from DOJ, who was initially scheduled was Michelle Begay Nakai, attorney for NDOJ. However, Desiree Deschini from Navajo DOJ will be representing DOJ. Ms. Dana Bobrow will be taking is the place of Chad Abeda, attorney for Office of Legislative Counsel. 5, close of the work session, announcements and adjournment. Mr. Chair.
Thank you, Ms. Benali. Motion, Monica.
Second, Delegate Paul Begay.
Thank you, committee members. Motion by Honorable Edison J. Winika, second by Honorable Paul Begay Jr. Roll call vote, please.
Yes, sir. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Paul Begay Jr. votes green. Honorable Pernell Halona.
Honorable Green.
Honorable Pernell Halona votes green. Honorable Carl Russell Slater.
Green.
Carl Russell Slater votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika.
Green.
Edison J. Winika votes green. Honorable Charlene So. Chair, vote of 5 in favor, 0 opposed. 4 in favor, 0 opposed.
Thank you, Mr. Mose and Cecilia, Honorable Vice Chair Carl Slater. Thanks for joining the call. So let's just proceed directly in to the work session. The first presenter, Ms. Benali, could you help us with that?
Mr. Chair, it is the staff from the Division of Behavioral and Mental Health Services, Dr. Michelle Brancer, Arsenio Charleston, Tanya Shepard, Nicole Begay. And also presenting will be Desiree Deschivi from the Navajo Department of Justice, and Ms. Dana Barbara, Chief Legislative Counsel from the Office of Legislative Counsel. Mr. Chair.
Thank you. Dr. Bransur, you have the floor.
All right. Hello again, Yate. This is Michelle, Dr. Branzer. I just wanted to see if we can review the PowerPoint. Hopefully y'all hear me okay. With the last, I think I sent it out yesterday, but also was sent before we presented to Hess, and I know that we had to go through it kind of quickly, and at that time, I believe you all wanted me to screen share, so I thought I'd review a little bit of this since we have Ms. Gischini here, and then Ms. Bobroff also, just to and allow everybody else to kind of just, you know, looking at the legislation, why Division of Behavioral and Mental Health Services is working to have these provider applications with Arizona State and the state provider applications to be approved. So I'll go ahead and go forward. And so here we have our mission statement and vision statement. I believe you may be familiar with this. Our scope of work, as you see, is a lot of for administration, everything that entails our infrastructure, as well as personnel, working with whatever financial areas that need with our 638 external funding grants as well.
Dr. Brancer?
Yes.
Excuse me, this is Angelita Bentley. There's some background noise. Do you have two devices on?
No, just one, but let me double check.
Okay, all right, I'm just checking. All right.
Yeah, no problem. I may double check here. It just says I have my speaker on. Let me see here.
Yeah, there seems to be a somewhat of a delayed echoing,
Okay.
like background noise, perhaps. All right, thank you.
Okay. Let's see if it's okay now. How about now? Are we okay now?
So far, it sounds clearer. Thank you.
Yeah, I think somebody else, I don't know. I just switched my speaker on and off, and hopefully that helped it. Okay, so our scope of work, and before was our mission and vision statement. As you can see, DBMHS, we are tasked with the scope of work of substance use disorder, but again, looking at the infrastructure that we have, including administration, all of the management areas that are needed, and leadership. And I was just stating how we are looking for ways, again, besides our 638 external funding, to utilize third-party reimbursements, which is the Medicaid billing, to make sure that we can, you know, continue our work and even expand our programs. So as you can see here, we have map, hopefully I'm still okay, map of the nation. And you can see we have 10 outpatient treatment centers all across the nation. We do only have one residential treatment facility, and that is in the Shiprock Agency. And currently that is still being renovated and made safe, you know, for our clients and staff, but they still run their outpatient treatment services there. I think I hear that feedback again. That's weird.
Okay, I'm muting another caller who had background noise. Thank you.
Oh, okay. I was gonna say, I'm checking my phone if something else is going on. Okay, so with that, as you can see, Division of Behavioral Mental Health Services is tasked with all of the nation to help our, as our mission statement says, help in every area to reduce our high disparities we have with substance use, behavioral health, and that includes mental health as well. And so we have here, oops, sorry, too fast, our continuum of care. And again, keeping in mind that the legislation is for the limited waiver of sovereign immunity. So what that means is we look at the reimbursement deliverables or services that we can provide and make a claim to like state Medicaid, which is under, the federal government under CMS for Centers for Medicaid and Medicare. And so we start for services, and that's continuum of care all the way from our screening until a client gets recommended to whatever treatment level that's going to meet their needs. Hopefully they complete their treatment and then they get discharged, and then we have prevention on both ends of the continuum, as you can see, to help us to maintain hopefully the person or family to have sustained recovery. And then evaluation is more for us to be able to make sure our services are meeting the needs, or do we need to do other things differently. In the middle, you'll see the half circles that are related to the other services that really help. What we found our Navajo people is more of the spiritual base of, if really the spiritual base of the individual or the family, if it's faith-based or Christian-based, or if it's traditional or NAC, or there's a lot of spiritual beliefs out there, but we really try to meet those needs to support their recovery. And wraparound is just meaning a service that helps from every angle to provide extra support for a person to sustain their recovery. And that can include other agencies like the legal department, the social services, other areas with family, and even other treatment providers, medical providers, things like that. And if they're children, it could be school and whatnot. So what we're looking at here is this area as well with billing or third-party reimbursement is that blue line that goes across, quality assurance, which is making sure that when we do bill, we're able to ensure that all the claims we make are meeting the standard, meaning the clinical objectives that are for that person's treatment. And that includes that utilization review. We have to make sure it's medically cleared, if you will. And then also we have to use a system, electronic health records or medical record system, to help us to maintain that whole fan, if you will, continuum of care. So that's how we know what's getting documented and what we can bill for. Okay, so hopefully you're still hearing me okay. The other area is the outreach program. This is an area that has, taken shape with more certifications, staff getting certified to become prevention specialists. And we can also include, hopefully in the future, peer support workers in this area. But you can see they really are in the community working with families, different agencies, if you will. We are also tasked with the QPR trainings for the nation, and those are often done through our outreach program. And as you know, COVID has made it challenging with this community outreach, but I know everybody is doing the best they can and also utilizing that social media that you may have seen. And then the next one area is, like I said, what we can bill for in some areas within the states. It really depends on the funding even of the state for traditional or faith-based services that can be billed, including these services here that you see with the bullet points. But those are areas that we're going to continue to explore as hopefully our Medicaid application goes through. We do have another program. You may be familiar with the REBA program, the Navajo Regional Behavioral Health Authority. As you may know, we have our new IGA or intergovernmental agreement that began July of this year and will go until 2026. So really, this is actually the Medicaid program in the state of Arizona with Arizona Access. Arizona Healthcare Cost Containment System. And that is what the REBA program works directly with. And we get funded to provide care coordination or case management, if you will, for Native Americans or the Navajo folks that are enrolled within that program to provide that, I guess, case management to get to the treatment services. Typically, they're off the reservation for residential services. And then you'll see this is the area that we look at as well for the billing portion. Clinical services. We do have licensed independent clinical staff. These are the ones that typically can, have we call provider numbers with the states for Medicaid, possibly Medicare in the future, and other MCOs or other third-party insurances. So with that, that is a crucial piece, is to have licensed independent personnel. The services, I guess, that we mainly provide are through outpatient treatment services, some residential, but we have not billed to this point at DBMH for residential. That would be a new area that we would want to start and building up to bill for residential. These other bullet areas are the services that can be provided in either outpatient or residential. This next slide looks more at our, like I mentioned earlier in that FAN, our electronic medical records or health records. It's called NetSmart My Evolve. And what that does, it really keeps us accountable to the services we're going to provide. Each staff member that works with direct care pretty much is in the system to some degree, whatever their scope of work may be. And also we have what we call reimbursement specialists. They are tasked to help us with the billing, and they also are part of going into this health record system to make sure everything before it gets billed to the third party insurances or Medicaid, that we're able to make sure that it's done correctly. Right now, it is a manual system from our electronic health records to the Medicaid portals through New Mexico right now is where we're billing. This one, I'm sorry, it's a little bit small and kind of hard to read, but really it's a slide that shows, again, the clinical flow of how we utilize our medical record system, our NetSmart right now. Again, it kind of follows the FAN, if you will, but again, at these different points is where we have our billers, have our providers or clinicians documenting the services that are done, that are being reviewed clinically, so then they can be reimbursed. We can hopefully be reimbursed through the Medicaid. And again, this slide is just underlining the point again. We want to provide quality assurance, and that is one section with myself coming aboard with DBMHS as the HSA now, has established a section we call quality assurance with our programs evaluation manager, Nicole Begay. So we're really building our infrastructure to make sure we are keeping track of obviously the billing, which is more financial with the funds that we can receive, and then the quality assurance again of the medical necessity of the treatment that's being provided. This slide again just shows the Four Corners area and the state Medicaid systems. And currently the legislation that was mentioned, Arizona 0244-21 is for Arizona here. And the 0241-21 is New Mexico with Centennial Care. And currently what we're doing is reimbursing for outpatient in our two New Mexico sites, which is in Shiprock, as well as Crown Point Outpatient Treatment Center. Those are the only two centers we're able to bill for currently. This one shows with Arsenio. I'll let you go ahead and do some of these slides. Are you still there, Arsenio, Mr. Charleston, our benefits coordinator?
Yes, I'm here.
Okay. I'm gonna go ahead and do these slides here, the client services.
Okay. Well, thank you, Honorable So and members of the HES committee for allowing me to come and speak before you. So one of the things that we utilize for DBMHS is looking at our data, and as our data drives kind of where we're going, and then also looking at our billing, as Dr. Branzer pointed out, is that we use the NetSmart system. So this was data that we had pulled, just demonstrating, and I know some of this was impacted because of the pandemic. Looking at our delivery of services and not being able to provide face-to-face contact. So for FY, the numbers we pull, the first set is our residential services, and in FY20, we for adolescents, and then for adults, we pull 16. And right now we're not operational with our residential services. And outpatient is, as you can see with our sites, and again, this is just outpatient that we're looking at. So like with Chinle, these are the clients that were served at each of the sites. And this is duplicated numbers, meaning that an individual may come maybe the beginning of the year, and then they complete treatment, and then they may come at the latter part, so this is unduplicated numbers that you see here presented before you. All right, thank you. Dr. Branzer?
Okay. Whoops. So this is a slide that Arsenio was talking about too. That's basically just another version of it as a bar graph. And then as you can see, of the clients that we serve, and again, looking mainly at outpatient for the fiscal year of 2020, the Medicaid that was, with the client that came to receive services, access was 54%. So that is most of our clientele, or more than half, I should say. And then New Mexico Medicaid was 13%. There were some that we served that did not have Medicaid, or maybe they, just were uninsured, if you will. And then also we looked at other, since the Four Corners has other states like Colorado and Utah, we didn't really have anybody in, except for Utah. Sorry, there was one client there. And this is just showing a timeline. And really this journey began even before I was the health services administrator, is looking at the different states and see how we could access the billing within the different areas here. So you can go ahead and read those, but we do have history in a sense of where we have billed in the past, but now with the applications for the state's Medicaid provider enrollment forms, some things have changed in there, and we do have to renew those. And so therefore we haven't been able to accomplish our goal of getting those applications approved. But you can see this is how we've reached out and worked on third-party reimbursement. So continually today, we still want to make sure that we're not, if you will, not being reimbursed for our services. This lets you know here, again, the revalidation with access is every 3 years. And we want to continue to work with the states. However, that's been our challenge, as we'll come to some of those slides too. Here's the next one. So our first challenge with New Mexico, and again, some of the, as I was looking historically a little bit at some of these provider enrollments, there are certain sections that after our legal review with Michelle Begay-Nakai now has been assisting us here at DBMHS. And this is one section in the New Mexico provider agreement application that typically Navajo Nation would not agree to, which is saying that all claims, we're responsible for them as the provider. However, if there's an issue with that, and let's just say it's New Mexico Medicaid or Arizona Access Medicaid, sees there's an issue with that, they would want to follow their HSD or Human Services Department and their MAD, as they call it, Program Policy Manual, and follow the federal, state law and regulations. So typically, again, that is what was pointed out, with a sovereign nation not agreeing that it would require Navajo Nation to submit to the state's jurisdiction, including the state courts. Another, excuse me, challenging area was section 1.33. And again, it's really relating to the state courts. Again, how I would view this more with my clinical hat on is if something was not billed correctly, or there was some really, fraud issues or something going on that shouldn't be with billing or things like that, then the way the applications are, or the provider applications are written is, yes, that they would follow the state's courts and state's jurisdiction. So again, that would not, again, be following Navajo Nation. The next challenge with New Mexico application or agreement is this article here of 16, and might be kind of small for you, but I know I sent out the PowerPoint. But you can read more. It's similar in a sense of if there's a grievance or if there's reconsideration of utilization review decisions, meaning let's just say it's New Mexico, Arizona Medicaid, questions why this person needed to be in residential treatment services. Us as the provider, DBMHS, has to be able to show that medical necessity. And if we don't, that's where it becomes questionable, I guess, for New Mexico Medicaid or Arizona Access. And that's what they want to look at, again, because this is the money is coming from the state, but through the federal, government, CMS. So again, if things were not going to be accordingly to way, like something is not correct, or we're not, meaning Navajo Nation, doing things in the manner of this agreement, then again, it's saying that we would have to follow the state and the basically New Mexico jurisdiction and law again. And this other challenge here is 18, Article 18. It states Navajo Nation will identify the state of New Mexico, its departments and authorized agents. And so as you can see right there, again, it's talking about the provider shall indemnify, defend in that manner. And so again, this is an area, typically that Navajo Nation does not agree to. So, we would, again, have to look at this more in depth. So that is with New Mexico. And again, that is the legislation 0241-21. And what you'll find too in some of these applications, you might see a New Mexico outpatient treatment center or residential facility mentioned in the Arizona provider enrollment forms or application, because we want to be able to, kind of utilize that if it's an Arizona Access member or Medicaid member receiving treatment at the residential facility in Shiprock, New Mexico, due to this agreement, then we would still be able to bill the Arizona Access Medicaid. And so that's why you would see in some of these applications, it seems like there's a mix or something like that. But really, that's the reason why we would do that. So for Arizona Access, there's some other areas within their provider enrollment forms or applications here in section B7. Okay, and some of this, we have looked at it. Again, the Navajo Nation provider must comply with federal, state, and local laws, as you can see. And then we had Michelle Begay, of course, she helped us review and attempt and keep working with the states as best we could, utilizing her legal expertise there. And one thing that was recommended is to include the word applicable after complying with all. That was one. This next area is section B12. And then again, similar, I think in some ways to New Mexico does not state Navajo Nation provider must indemnify the state in access. And then again, Navajo Nation does not indemnify third parties. That would be another area. Additionally, for section B14, this one here is talking about appeals or claims that are disputes filed by the provider. Requires the nation to submit to Arizona law and jurisdiction for this. And DOJ recommended that this third sentence here, provider waives any right to attorney's fees, be removed or not recommended in that manner. This next one is section B21, provisions requiring the nation to submit to the jurisdiction of Arizona courts and agreeing to pay for the costs that access incurs in such proceedings, meaning that I guess we would be paying for these court proceedings. Again, and this would be if something were causing it or making, I guess, the allegation or whatnot that Navajo Nation is not billing correctly or something has happened and that it became more of an issue. So that's when that would probably be applicable. The next challenge, section B30. You can read that here. They did include this in their newer provider enrollment form, that the provider, meaning Navajo Nation, would verify United States citizenship or lawful permanent resident status prior to the signing of this agreement. And this is probably, I'm not a full resident of Arizona, but I know there's been issues with, people that are not documented and things as such. So I guess they felt that it was important to put that in here, something similar to that. So our Department of Justice recommended this provision be stricken as the nation's position. It's really not applicable to us. And so as you can see, those are the challenges after review by our attorney, that was Michelle Begay-Nakai. And then we wanted to add some other slides again about the opportunities, because as becoming aboard as the delegated HSA for DBMHS, and now I am the HSA for DBMHS, just working with those government to government relationships with Arizona Access. They also have a lot of tribal consultations with the states, of course. And so this is an area we reached out and again to work on and see if we could work on these changes for their Medicaid provider enrollment forms. The main suggestion from the state, or of Arizona that is, was to bring this up at tribal consultation this next year, 2022. And so we still are needing to follow up with that because time just continues to tick away. We do want to make sure we're able to do that, as well as why we're going forth with this legislation too. And then the next one, training and technical assistance centers for congressional authorization. I have also reached out to CMS here, the Centers for Medicaid and Medicaid Services, their Tribal Affairs Division. And the main recommendation, which was helpful, but did not apply so much to us here as with the Navajo Nation government with DBMHS, is to kind of look at the model from the 638 contracted healthcare organizations and how they're able to get their Medicaid provider enrollment forms approved and signed. But again, they have their own board and other kind of stipulations they follow, which is separate here from the HES committee or Navajo Nation processes. So the other area, again, we talked about Arizona Access. The all-inclusive rate is a rate that, we can, advocate for with being, with, DBMHS. And, that is something, again, that we would like to receive, as well as look at the other types of reimbursements, as I mentioned earlier. This last one just again highlights the opportunities that have been before DBMHS, which we haven't been able to move forward with. And again, this is pulling from the health record system we have through NetSmart. And again, this is going back to 2019. So this is obviously a time when we didn't have, this is COVID was starting, so we didn't really, as full functioning yet. But you can see the reimbursement rates at the time, what the traditional services would have been in 2017 here. The FFF is fee for service, it's a different rate. And then the total, that's all for outpatient. And that's just pulling numbers. And again, this relates to us being able to make sure our infrastructure is looking at the billable encounters and the hours tied into that pie graph you saw with individuals that were within New Mexico Medicaid or Arizona Access Medicaid. And then for residential services, as you can see, looking at the reimbursement set for the 2019 adult reimbursement rate, youth reimbursement rate, across, and then the totals for that. And then putting the two together, the five, almost 6 million, almost 2 million, almost $8 million there. So these are revenue streams we would definitely like to use within DBMHS. And then we have also worked with a consultant group. Tribal Health Alliance is the group that has been assisting DBMHS for the past year and a half, maybe two. And what they found when they were looking at our, numbers, if you will, from our data from the health record system, also, trying to make sure, how we can capture, any third-party revenue so we don't lose it. That's why they put it as an urgent recommendation. And so, they're wanting to make sure what our challenge was. And again, that's why down here you see, we needed to get approval. Obviously, Department of Justice has made their comments known, which is true, the things that we needed to be addressed in this legislation and other areas, probably tribal consultations, things like that, to help make sure that we can, get the ability to bill for third-party reimbursements. And this is the numbers that they ran from this, they meaning Tribal Health Alliance. Once again, we gave them our data, if you will, to see how it looks from this area of loss. And, again, going back into the potential revenue that was there. And then looking at the two sites, like I said, currently that we are able to bill, because we have our clinicians, rostered in, if you will, with managed care organizations, and we have been able to bill some there. But again, these are things that we have to look at even more internally, because we want to make sure when we submit claims, they are sufficient. They call them clean claims a lot of times, that they are meeting the standard, so there won't be any issues with what some of those challenges are covering in the recommendations. So that is the last of the slide. I hope it helped those of you who weren't on the last presentation, or the HES committee members. Thank you again, Hia, for helping and wanting to assist us with this endeavor that we have. So I give that back to you, Chair, Honorable So.
I have to do *6. Thank you, Dr. Bensur.
Mhm.
Committee members, do you have any questions? And Dr. Bransur, the main aspect for requesting the limited waiver of sovereign immunity. You know, we get these requests from enterprises and they usually put a value on it. What is the limited waiver to if we don't do something that's in the agreement? What is the penalty? What is the cost?
Well, thank you for the question. So I'm just trying to make sure I understand. So if we don't do something in these provider agreements, what's the consequence, or when you mean cost?
Yes,
Okay.
cost or penalty.
So typically, and this is when I've worked with other billing capacities, agencies and whatnot, what happens is, you know, the Medicaid agency will do an audit to make sure, again, that whatever the insurance is paying for, you know, that it has that medical necessity and it's correctly billed. And so what usually happens if there is a discrepancy or something wasn't documented correctly, the Medicaid will usually, whatever state Medicaid will say, this is what we found, comparing, you know, the documentations, electronic health records, all of that. And they will want that certain, maybe they paid out, they would want that returned back to them or reverted back to them. So typically that's why, as a provider, we have to ensure that we are making sure that from that clinical process I was mentioning earlier, everything is done correctly and we make sure it's getting submitted correctly to the Medicaid. Right now it's a manual system in their portals, but at some point we'd like to create and develop a clearinghouse that's for third-party reimbursements that would assist us in making sure those treatment service claims are, again, sufficient or clean. But that's typically the consequence, is that if there's a discrepancy, they will want to, you know, that money that was given to the provider will need to be reverted, unless it's like a huge fraud issue. I don't know, some places have hospitals, other places have gone through these before. You know, that's why, you know, it's not good to do those things, but their agency or whatnot would not be able to have a Medicaid, you know, number, you know, because of whatever the issue was. I'm just using fraud as an example.
Chairman, so
Thank you, Dr. Brent. Yes, I was pointing the phone in your direction, Miss Barbara.
oh, thank you, Chairman. So, if only it was that simple. I think that I would like, if allowed, I would like to rephrase the question. So the consequence of the limited waiver of sovereign immunity not being approved by the council is that these agreements, the provider participation agreement, cannot be entered. So the question I would ask DBHS is, what is the consequence, financial and otherwise, if if the nation cannot enter the provider participation agreements?
Agreement.
Thank you, Chair. So.
Yep. Thank you. Thank you for that clarification. So in essence, we just would not be able to bill that and not be able to, utilize or capture those reimbursement rates that would assist DBMHS to continue to grow our programs. And, even as we look to figure out why, we're not able to retain professional staff, so that we can, provide more services at the facilities that we currently have. So, I mean, it would still be main revenue from, the 648. We're all jamming out a little bit, I guess. So yeah, so we wouldn't, be able to bill in essence. That would not be able to happen.
Committee members, anybody else? So as I reviewed the legislation with Mr. Chatabeda, there was a part in there where Department of Justice was asked to comment on a portion of it. And I'm wondering if DOJ is ready to address that particular issue. It's that last part before, in the findings section, that last paragraph. And if DOJ is not prepared, then should we even put it on tomorrow's agenda?
Chair, so this is Latanya from DOJ.
Yes, go ahead.
To my understanding, Michelle has reviewed, I'm sorry, let me back up. As indicated by Dr. Brancer, Michelle Begay-Nakai is the lead attorney on this issue. She has assisted the program with negotiating the matter, has been in contact with counsel for both states. She has also reviewed the legislation for both the Arizona and New Mexico and provided those comments to Chad via email. The only outstanding issue, to my understanding, was dealing with whether to have this work session. I would like Chad to send me that last outstanding finding email, and I can, if you could circle back to me and I can review that. Thank you, Chair. Thank you, Chair.
Ms. Bob Ross, could you help the committee with that
Sure.
particular?
One second. Thank you. I thought I was on mute. So, Latanya, what Chair So is asking about in the legislation, I believe what he's asking about is in the legislation on page 3, paragraph E, and I am looking at let me see which legislation I'm looking at. I apologize. I'm looking at 0244-21. On paragraph E on page 3, it says that Navajo Nation Department of Justice reviewed the Arizona healthcare cost containment system provider enrollment forms for DBMHS to enter into a provider participation agreement with the Arizona healthcare cost containment system and provided a memo expressing concerns regarding an indirect waiver of sovereign immunity. I interpreted what that clause.
Yep. Hereby, they were thinking of putting Christmas.
I interpreted that clause to mean that DOJ has expressed that you have to go to council to get the limited waiver of sovereign immunity, that it cannot be done without approval of the council. That's in the code. Plus, it's as DOJ certainly, and I think this is what they were implying, was that waivers of sovereign immunity by the nation have to be express and direct. So that's what I know, LaTanya. And Chad is on leave this week, so he is not on the phone, but I will reach out to him if there's more you need.
Chair, so if I may provide a comment.
Yes, you may.
Thank you, Chair. I have pulled up the email that I was included on, and my colleague Michelle provided proposed amendments to the legislation that Chad had drafted. And in both legislations, Chad had included DOJ's memo as an exhibit to legislation. And considering that memo was attorney-client privilege from DOJ to Department of Behavioral Health, Michelle had recommended that the memo is not included as an exhibit because it's attorney-client privilege and it's confidential information. However, Michelle did provide additional amendments to the legislation that would provide HES and council information as to what they would need to provide a limited waiver to. And that's provided in the new exhibit, I'm sorry, the new paragraph E as an egg. So to my understanding, Michelle has provided all the information, and I'm not aware of any outstanding issues between DOJ and legislative council.
Chair, this is Dana again. I agree with
Go ahead,
LaTanya.
Ms. Barbara.
Thank you. I agree with Ms. Johnson that DOJ and Office of Legislative Counsel have consulted on this. DOJ reviewed the legislation before it was dropped and believed it was sufficient, as did Office of Legislative Counsel. So as far as the legislation, I think you're good to go. If you have specific questions about what the limited waiver, what it's waiving, that is listed in the legislation. And I think the end result is without this limited waiver of sovereign immunity, the nation cannot enter the agreements, the provider participation agreements with the state. I think it was just presented as what some of the consequences might be if the nation cannot enter those agreements. Thank you, Chair.
Thank you, Ms. Barbara. I guess in this teleconference, in this belated message, Honorable Vice Chair Otto So is on the call. Committee members, do you have any questions? Both of these legislation, so the one for Arizona and the one for New Mexico, 241 and 243 will be ready for action tomorrow. There are no questions, and I think we're pretty much good to go with the issues that Dr. Brancer was concerned about, as well as what Legislative Counsel Chad Begay was also concerned about.
Mr. Chair, this is Angie Benelli.
Yes.
Mr.
Go
Chair,
ahead, Mr. Null.
thank you, Mr. Chair, and members of the Health, Education, and Human Services Committee. I see Ms. Johnson is, I'm going to need, after the HES committee approves these two legislations, and then they're going to be including as an amendment, the amendments that I think Ms. Begay-Nakai is providing. And so I would need that language so that I can submit it into the HES committee report as a approved amendment, and then it'll move on to the next committee, which would, I believe it's BNF. But I don't know who has the that proposed amendments for these two legislations, but that's what I would need for tomorrow.
Angie and LaTanya, but my understanding was that the amendments that DOJ wanted in the legislation, those amendments were to the original draft of the legislation, but the final draft includes those amendments.
Okay.
If I am incorrect, if the Department of Justice will prepare the amendments they want and send them to me, I will get them ready for tomorrow's meeting. I don't think there are any amendments. I think they're already in the legislation.
Okay, that'll be perfect. Thank you.
So
Yes, go ahead.
I just wanted to confirm that we agree with what Dina just noted. Those amendments that we spoke about were done prior to the legislation going into a public comment period. So there should be no amendments that should be introduced unless the committee has other amendments.
Yes, and that was the discussion, and the reason I wanted to focus on that is to make sure we were clear on it, that it was included. Thank you. Committee members, for your information, the legislation to confirm the appointment of Dr. Harold Begay will be at 5 p.m. We'll have cleared the 5-day comment period. Attila, Honorable Vice Chair Otto, so I know you're at the Legislative Services. If you want to co-sponsor that legislation, Ms. Jalissa Johnson has that legislation. Auto committee members, if anybody else is close by and available and you want to sign on, that's perfectly all right. There's no other questions, committee members. If we're clear on what we'll do, what we're going to be doing as we proceed with the Division of Behavioral health services agreements. We're ready to proceed. The other aspect was, and Miss Michelle Morris, the one that I'm really concerned about is that tri-state agreement regarding Deltec services and the fee schedule. That particular agreement hadn't been addressed since 1979, and we're way past that. We're probably the fees that we're basically billing for on the meals is probably way outdated. There was some preliminary analysis that said we should be charging closer to $9 rather than the fees. I think they average about $5. So we've been operating at a loss for many years, and if we could get meetings with the parties from the 3 states, the state of New Mexico, the state of Arizona, and the state of Utah, such that we can get proper reimbursement. Committee members, so that would be, and then the other is the follow-up meeting. Just over the weekend, Dr. Charles Monty Russell highlighted there's a foundation that is tracking the data from all the public high schools in the state of Arizona. And that foundation is willing to host a meeting down in Phoenix or Tempe to share that data. And I think it would be real beneficial for us as well as for all the folks within, let's say, the Department of Diné Education. So those are upcoming items. And we also ask for follow-up work with the New Mexico Public Education Department. So we will discuss that further tomorrow, committee members. And just remember that the Office of Legislative Services wants to host a meeting with all the LDAs in Albuquerque on December 17th and 18th. So that would be some items that we really need to make sure that it's part of our schedule. Thank you. Anybody else, committee members? Not, then committee, you're willing to do a motion to adjourn, or the chair can just call for adjournment?
Second motion, Chair. Salona, motion to adjourn.
Okay, sila, just now us. Accept the
Second,
motion to
Wanika.
adjourn. Oh, Sila, thank you, Honorable Wanika. Motion and a second to adjourn. Che, Honorable Leonard Mose, you keep us in rolling. Roll call vote.
All right, sir. Honorable Paul Begay Jr.,
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Salona,
Salona votes green.
Honorable Purnell Helena votes green. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Wanika.
Green.
Edison J. Wanika votes green. Honorable Carl Russell Slater.
Green.
Vote of 3. Honorable Carl Russell Slater votes green. Chair, a vote of 4 in favor, 0 opposed, adjourned at 2:22 p.m.
Okay, thank you, committee members. So we'll talk again tomorrow at 10 a.m. and perhaps dispensing with reports. So we'll just address the 3 legislations that will be ready for tomorrow's action. That way we can conclude the business so that our staff can have some time off tomorrow afternoon. Thank you, committee members. Be safe, be careful, wear your mask. I got a notation from Roseland, so Gallup Indian Medical Center is booked and overbooked on patients being on respirators and ventilators. The same is true for Northern Navajo Medical Center. And I read an email that San Juan Regional Medical Center in Farmington is at capacity on the usage of ventilators and respirators. So be careful. Take care of yourselves. With Ayla and I, we are adjourned.
Happy Thanksgiving.
Yep, thank you, Chair. Happy holidays.
Thank you, HES committee. Go ahead.